Hey there, my name's Emily Koenig, and I'm the Executive Director of St. Louis County Children's Service Fund, or CSF. You may not have heard of us, but that's okay. Let me introduce you to our organization. We invest in kids. Our focus is improving the lives of kids and their families by strategically investing in programs and services that deliver effective and quality mental health and behavioral health services. We also provide substance use prevention services to youth ages 0 to 19 and their families. How do we do this? Well, we can do this because of you. St. Louis County Children's Service Fund receives annually about $45 million a year. And over the last 10 years, that has resulted in more than $450 million going to children's mental and behavioral health and substance use services in St. Louis County.
I am Randall Sturkle. I'm a community pediatrician in St. Louis County and the board chair for the Children's Service Fund. In 2008, with a goal to improve access to mental and behavioral health services in St. Louis County voters approved Proposition 1. So many of the services that the kids are able to access in our county are funded through the Children's Service Fund, and I can't imagine where our kids in our community would be without the funds.
So what are those quality programs and innovative partnerships? Well, it's programs like counseling and art therapy. But it's also nights in a shelter or assisting parents by helping them navigate the challenges of parenthood with education and respite care programming. And it was making sure kids and providers could stay connected during the pandemic through telehealth services. Or innovative partnerships like our Grassroots funding opportunity, which came from listening to our community and identifying gaps and needs not currently being met.
So a Red Circle is a nonprofit organization based in North St. Louis County. And we focus on trying to make the space within North County better for the residents. So I first learned about Children's Service Fund shortly after I founded a Red Circle. It was for one of the larger grant opportunities, and since we have programming within the educational space that works with kids, I thought that would be a good fit. We were not ready yet to apply for that grant, but I did continue to follow, any type of grant offerings. I signed up, I think, for the newsletter or something, and I got the emails. And so when we saw the Grassroots, I was like, we qualify for that one. So we were able to apply. So the Grassroots Grant from Children's Service Fund funds our educational advocacy programming. And what that is a program that allows us to go into the elementary schools and partner with classrooms to help children basically regulate themselves so that they are in less danger of being suspended or facing detention. And so we do some things like find them resources for behavioral health services, grief support, basic needs, food, clothing, shelter, those types of things. Anything that, will help a child kind of regulate themselves so they can actually focus on learning.
I'm Pat Holterman-Homas. I'm proud to be the president and CEO of Youth in Need. Youth in Need was founded and is headquartered in St. Charles, Missouri, but has grown to serve the entire eastern Missouri region with programs for kids of all ages and their families. So everything from early childhood education for families experiencing poverty, to mental health counseling for children of all ages and their families, to crisis outreach, emergency shelter, transitional living, and other supports for youth experiencing homelessness, and foster care. The two main program areas that we have with CSF are mental health counseling, which we provide in many schools, elementary, middle, and high schools throughout the county. And again, that just makes the services, they're right there where the kids are. The other area of programs we have are for older youth who are really in crisis and experiencing homelessness. And that includes youth who may be pregnant or have a baby in tow. And we do everything from street-based outreach, really trying to get the word out and connect with young people where they are. That we do that through our own street outreach team, through our partnership with the Youth Connection Helpline, which is an amazing resource, and through our Safe Place program. And through CSF, we've been able to also educate youth about Safe Place so that we're in schools and other community settings talking about Safe Place so that youth know that if they're having a problem, if their friend is having a problem, they can look for that safe place sign and immediately get help. CSF has been a wonderful partner. Obviously, it was a new entity, so figuring things out, but I would say through all of those 12 years, they've always worked hand in hand with us to figure those things out. What is the best way to allocate those funds? What do kids need? They really have always reached out and really listened, really cared, and held us to a high level of accountability. I've always felt a sense of mutual accountability between the providers and the Children's Service Fund, that we all feel very responsible to be very good stewards of those public funds that are entrusted to us, and to use them as wisely and effectively as possible.
Since that vote in 2008, we went from putting kids first to keeping kids first. Our mission will always have kids at the center of it, and as our community is evolving and needs are changing, we are too.